Do you remember a few months back, I met with Dr. Wasim and we chatted about fillers and how amazing they can be. And I was a little bit like, oh, do I really want them? Anyway, since then I've turned 60, so I've come back for an assessment. And I only trust this gentleman. What do you think?
I think we can do fillers in a clever way, but I think it's always really important to speak to the patient first and ask them what they think. Then I'll give my opinion, and if we have a crossover, like the Venn diagram, that bit in the middle, if our ideas are married, that's what we'll go with. So should we start with you telling me what you see first?
All right.
And I'll come in right afterwards.
Okay, so my history of fillers is that I'm wary because I've got a big face. We've talked about this before. I've had fillers around my eyes and it doesn't work because I've got I've got an eye area that's problematic. It's prone to swelling, so I understand that I can't have eye fillers. However, we talked about doing maybe a possible little bit in here to get rid of this hitching here. What did you call this bit here?
Hammock.
You call it a hammock.
We talk about a hammock being pinned by a palm tree this side. Yes.
What do you see? Be brutally honest.
So
Wasim.
We already discussed this last time. So we did talk about this area. So this area is called the prejowl sulcus. Anyway, the point is there's a ligament here and there's a ligament here. And as time passes, the fat in between those ligaments gets bigger and heavier and starts to move down. But these ligaments hold it really tight. So the fat kind of stands in between them, and that's why you kind of get this interruption of the jaw line. It does this. So what we do is we never, ever, ever touch this. We leave that alone. We try and work with light and shadow. So if you can see, let's try and get a good angle. Can you see how that kind of dips in? The idea is to make this a little bit straighter. So I'm going to bring this part, prejowl, down so I get a nice smooth mandibular line, it's called, which just basically is a fancy medical word for jawline. Possibly put a tiny, tiny bit around the back as well, and it will just create a very, very nice smooth jawline, and it will hide this. We're basically hiding it. Okay. The other thing is, relax, is when we smile, the muscle does this. It turns the lip inwards.
Yeah.
So it goes from that to
it
turns in. So muscle turns in. So what you do is you have to weaken that muscle's ability to curl the lip in. So you put little droplets of neuromodulator up along the lip line. What happens then is when you smile, it maintains its thickness. So it's called a lip flip. The Wasim lip flip. Okay, so that's what we can do. We're going to create a tiny bit of, we're going to maintain the lips volume as much as possible when you smile.
Do you think they need a little bit more volume?
We can't do both at the same time.
Oh, okay.
So what I would do is probably do
the neuromodulator first. Do the lip flip first.
Yeah, see if you like that first. Exactly.
Okay.
Exactly. If we just turn this way, other areas that we can put filler. Specifically because Nadine does a lot of TV camera work, she's always talking, so it's really, really important that whatever she uses has to move naturally with her face. You can't have any lumps or bumps or any kind of giveaway signs. So you can't just use hyaluronic acid. You have to use resilient hyaluronic acid that mimic the natural HA in your skin to stretch and move accordingly. So when we put any filler around here, this is a highly mobile area, it has to be resilient. Same here, so you can see as Nadine smiles, the tissues are moving. So we have to be very, very careful in what we inject in this area.
I mean, I have a very mobile face, so
Good.
Was a little bit more mobile a few weeks ago.
There you go. All right. So other things. Sometimes if you see there's a tiny, tiny bit of shadowing here, ever so slightly. So what we could do here is put a tiny, tiny bit of volume so that this transitions and this sort of groove here becomes a little bit less obvious. It's only going to be a little bit, a tiny bit. Just bring this forward.
Do you know what? It's really interesting as I get older and people ask me what I dislike about my face. It's actually not really the lines. I actually don't dislike these. It's the concavity, convexity.
Yeah.
And that's what filler, I think, really subtly put in can change that. So when you see me under certain lights, under one light, I'll look 30, and then you go under another light and you suddenly see the dips and shallows, and suddenly you age 20 years. Yeah. And that's what I'm hoping you can get rid of.
And that's what filler needs to be. It needs to be working with light and shadow. Yeah. It's not about necessarily always volumizing.
No, because I don't need the volume. Yeah. It's to get rid of the light and shadows. It's the light and shade of good filler. It's the bit where you takes your makeup off and shows you what your skin really looks like.
So you can see here, can you see that there's a dip here in that? Yeah. So what we're going to try and do is blend this with the chin. And so this shadow, you can actually see exactly where the filler's going to go. It's going to go right in there. There's a little bit of shadow here as well. So you might add a little bit of tiny, tiny baby amounts.
It's very interesting that the more you look at my face in different lights, the more you're going, oh,
no,
just a touch more.
You have no idea how little I'm using. I think we might even get the whole thing done with one syringe. The point is the most forward part of the jowl and the chin be in one line. And then round the back here, If you follow the jowl, you can see that it ends about here, and I would then be just be doing a tiny, tiny bit of volumization there. So that volume and that volume will create a nice new blended jawline. Then, because we also spotted and agreed there was a tiny bit of shadowing here, I may add a tiny, tiny bit of filler there, but that's it. And then we'll have a look at the jawline afterwards. And this looks like it's very long and scary, but actually, it's round tipped, so it's not sharp. That first needle was to create the entry point. And now all I'm going to do is come to my point where I've drawn the shadow to be, and very gently inject backwards. Very, very, very thin line filler.
Oh, wow.
And you'll see, slowly, as I start to do these little threads and blend them. Remember, this is so clever, this filler. This is smart filler. This filler is going to blend really nicely into tissue and move normally, so it's not going to lump and bump when Nadine smiles, because it will start to numb very, very slowly.
I barely felt a thing. I barely felt a thing. I was obviously mesmerised by his gorgeous eyes. They were like the snake out of Jungle Book.
So what you'll start to see is, we're not finished yet, but I want you just to start having a look. Can you see how that is starting to look a little bit straighter? And we're starting to, you see how, can you tell from that angle? Well, not really. It's very difficult to, that's just a tiny, tiny bit I've done so far.
And now, genuinely, I can't be in a
Can't
thing.
think.
No.
Okay, good. Let's have a look at
The
different
hardest
angles.
thing for me is to shut up while he's doing it.
Can you see how it's just looking a bit smoother now than before? There was it had a little bit of a dip there.
So this side is done here. Just
I'm
do
gonna
this
do the
there, and
back.
this side is
Do the back now as well.
do some back.
There's no need to have all the filler done in one go. So actually, I would prefer that Nadine go home, so see how she likes it, puts her makeup on, daily routine is everything, sees herself in different light, different shadow, in daylight in front of a shop window, in her own mirror, different parts of the house. Then she'll see the differences slowly, and then we'll come back in for another session in 4 to 6 weeks, do a little bit more. And that's how you avoid overfill, because you're very slowly building up over time. You can see from now what we're trying to achieve, because you can see a brand new jawline here that's just coming through. It's just a lot
Yes.
smoother there.
Yeah.
But it's not,
So
it's not
you see,
dramatically
on
different.
this side here, can you see a slight sort of sadness to this part of the face? It sort of goes in slightly, and you get this in, so it goes out and then in and then out, like a tenting effect. Whereas here, this is now smooth the way it used to be, and then you've got a smoother line here.
Yeah.
See how subtle it is, but that's exactly what you want. So this is a smooth line now, rather than going whoop.
Yeah, exactly.